Do you have back pain that you've been told has been caused by a disc disease or an unstable disc? Well, here are the top 3 exercises you can do to help with that. I'm Anthony Gosh, the lead neurosurgeon of the Spine MDT. Nothing I say on this video or on any of my videos constitutes a consultation and is not a substitute from an assessment from a qualified healthcare professional that has seen you. Don't forget to hit the subscribe button. We post weekly videos to try and help patients living and suffering with spine disease. Also, don't forget to visit our website, which has lots of useful information for people living with back pain and spine disease. So you may have had back pain that centered somewhere down in the lower back, sometimes spreads across the waist. It doesn't necessarily radiate down your leg. You may have had an x-ray or an MRI even, and you've been told it's down to disc disease. Well, first let's have a look at the anatomy of the spine to try and understand what this means, and we'll look at what kind of symptoms can guide us as to whether that really is the cause of your back pain. Your spine is made up of a stack of bones called vertebrae that start from pelvis and work their way all the way up to your neck. Each bone is a cylindrical block of bone with an arch on the back of it, and if you stack up these bones and arches, they form a tunnel down the middle that contains and protects the spinal cord and then all the nerves that help innervate your arms and legs, the muscles of your arms and legs. The bones themselves are then cushioned by the discs. That's what the discs are. They're cushions that sit between the two bones that allow a couple of degrees of movement at each level and a bit of shock absorption. The way to think of a disc is they're made of two components broadly. A squishy central component called the nucleus, which is made of a special type of collagen, a sort of fibrous material that's a bit squishy and bouncy, and then that's surrounded by a kind of thicker outer material that just helps keep it in place, helps it do its job. Now, sometimes what can happen over time with bad posture and the kind of jobs we do, especially if we're sitting at desks for long periods of time, the disc itself, the sort of outer lining can have little tears in it, or sometimes with excessive downward pressures, this disc material here can start to move around, move to one side more than the other side, or more than the middle, or even worst case scenario, you get a tear in the outer lining of the disc, and some of this disc material breaks away and herniates out, so actually squishes out. So there's a couple of ways to tell if this is the case. If the pain tends to come on when you're sat in a kind of uncomfortable position and it's difficult to get comfortable, but tends to ease off a bit when you walk, it tends to be a bit worse as you're standing. The process of you actually standing from the chair to get going can be quite painful, but once you get going, once you walk a little bit, that movement as you're walking, that swaying side to side of your hips, slowly eases the pain. That could be a sign of the disc itself being the cause of your back pain, and that's because this central disc bit here has moved a little bit to one side and put an imbalance in the forces around this area, and that gentle movement of walking a little bit has moved it back to the middle, and over time it's kind of eased off a little bit, and that's a sign that it could be coming from the disc. Those pressures that cause that can come for a number of reasons. Sometimes just being sedentary in a chair, sitting in a slouched position, putting a lot of strain on the back is one cause of it, but also certain exercises as well that make you a bit over flexible can cause that problem. Your spine is held together by a group of muscles, so to hold it upright, it does actually require a certain level of stiffness. If it's a little bit too flexible, that's one of the causes that can tear discs or cause imbalances of movements of that nucleus. Stuart McGill has actually done a lot of work on this. He's a kinesiologist in Canada who did a PhD in the biomechanics of the spine, and has probably done more biomechanical research work on the spine than anyone out there, both in laboratories with mechanical models as well as in his clinic with actual patients. And he studied the dynamics and mechanics of the disc, what sort of things stabilize it, how they generate pain, what different causes of back pain are, and he's actually a big promoter of the fact that there is no such thing as non-specific back pain. Every type of back pain has an underlying cause. So he's a big believer that if the pain from your back is caused by disc disease, and some of the methods I've just discussed earlier are how you can tell, then you actually want to deliberately create a kind of stiffness, if you like, around the spine. And by that I mean increase the spine stability by really strengthening the muscles that surround and support the spine. So you're building up a kind of natural brace that you wear around your spine. It's a natural brace that's formed by the muscles of your back and your waist. So for this type of back pain, if you're someone who enjoys yoga, that's probably not the best exercise for you, because that actually increases flexibility and you want to actually help tighten this up. Maybe Pilates type exercises are better in this case. On the website link below, there's an article I've written on yoga versus Pilates for the spine. So in the context of when you need to build up that rigidity and stability around your spine, there are 3 exercises that he has proven are the best for doing so. The first one is a McGill curl up, and there are variations of this. This is for what he calls beginner level, i.e. when you're quite in a lot of pain and you're a little bit restricted at first with the movement. So the idea is you lie flat on the ground and you do one side at a time first. All of his exercise try to load just half of the spine first, and that way it gets easier to build up that core strength and stability. So here you lie on your back with one leg flexed like this with your knee bent, and then the opposite arm tucked under your back to maintain a nice natural arch, what we call a lordosis. And then you tense up, brace the core, and then gradually try and lift your head and shoulders, or your head predominantly, off the ground, tensing up the core as you're doing so, just up to the point that pain allows. Hold it there for a couple of seconds and then rest. And he believes in doing sort of 12 seconds on, 12 seconds off for quite a few reps to start with. Then you switch legs, bend the opposite knee and put the opposite arm under the back. As you get better at this, or as you feel the pain's improving slightly, then you can try crunching that a little bit further to try and get the back of the shoulders off the ground ever so slightly. Now, as pain allows, you can then adapt it and just add a bit more resistance to that same exercise. So this time round, you extend the arm out and start to lift the straight leg, the one that's remaining straight, off the ground, whilst the opposite arm, the one that you've extended out, starts to come off the ground as well at the same time, but also raise your head off the ground at the same time. So it's a bit like the earlier one where you're just lifting your head up, but what you're doing is you're adding the resistance by lifting that opposite leg up and the opposite arm. So it's left arm with the right leg straight and lifting it off the ground, and then you do the same with the opposite side afterwards. The next one is a side bridge or a side plank. To start with, depending on how much pain you're in, this is what is like an intermediate or slightly easier version, where you have one foot, the outer foot, sort of in front of you, and the lower foot, the one nearest to the ground, behind that foot. You've got your weight on your forearm, and then you lift your pelvis off the ground. So you're actually putting all of the muscular contraction is on this floor side, if you like, the left side of this patient here. That's the sort of the side muscles that are contracting to build the core on that half of the side only, and then the upper side here is actually unloaded and not much resistance up at this level at all. And then you can sort of rotate, bring the hip pelvis forward and back again, or just stay like that static. If you're finding that trickier, it's a bit too painful, to make it slightly easier, you can actually have the resting point on the knee and the outer part of the foot. So slightly less weight you have to bear when lifting your pelvis up, but still maintaining the pressure here down on the forearm. And if you're quite deconditioned or find those earlier methods a little bit too painful, to make it even easier, in the standing position, just leaning against the wall, that takes a lot more weight off you when you do it. Start off with a normal forward plank, but you're doing this against a wall here, just a few feet apart, away from the wall rather, resting again symmetrically, forearms on the wall and tensing up to maintain a kind of fairly straight line between legs and back. And then what you can then do is, to create the same kind of side plank effect, which is a bit more resistance, you load one side more than the other side by taking, in this case, the left arm off the wall and rotating the pelvis and the shoulders here. And that has a similar effect, targets the same muscles. And if all of that has become easy and manageable, the next stage of the side plank is just to make it a little bit harder. Instead of having one leg right in front of the other and both equally resting on the ground, you bring this back a bit so it's actually resting on the other foot. It just gives you a little bit more resistance. And finally, the bird dog. This is where you go on all fours. Before you start the maneuver, it's very important to allow your pelvis to rotate forward from the hips. So rather than just let it all sink, just focus on rotating the pelvis forward slowly, getting into that position. And then you gradually raise the opposite arm and leg off the ground. So left arm in this case, right leg. Keeping that pelvis rotated forward, hold it there for a few seconds. And maintain that sort of isometric static hold, or you can try even doing that as repetitions as well, and then don't forget to do the opposite side. If you're finding that easy, you can adapt it slightly by, once you've done the actual move itself, you then kick the leg outwards a little bit and the opposite arm, kick that outwards a little bit, hold it, and then bring it all back in slowly. And if those exercises feel way too difficult, then you can adapt the bird dog. So if you just get on the hands and knees position, just allow that pelvis to tilt forward slightly, maintain that, brace the core, and then see if you can hold that position, but take one arm off the ground. Just take the resistance off one arm at a time before you then advanced to what was previously shown of lifting the opposite knee up. And believe it or not, those three exercises that he swears by in the context of these sort of unstable discs, or in patients that he feels could do with really powerful stabilization of the spine, he uses those same exercises on elite athletes who don't actually have back pain or back disorders, including the NFL, American football players. He studied the biomechanics in boxers, so you know that improving that stiffness, even in sports where a lot of rotation of the waist is required, such as in boxers when they're throwing a punch, actually creating some stiffness and maintaining that core stability at the very end of the rotation delivers far more power in either a throw in some sports or a punch or even in a golf swing. So he even uses these exercises in elite athletes, so they're a good part of a normal exercise routine, even if you don't have back pain, to try and prevent yourself getting back pain from an unstable spine. I hope you found that video helpful. If you did, please click the like button, and again, don't forget to subscribe. It helps people suffering with back pain find this content, and it can help them. Our goal at the Spine MDT is to find the least invasive solution that gives you the longest lasting result, and we're able to do that by being a multidisciplinary practice, having professionals of all disciplines of spine care, chiropractors, osteopaths, physiotherapists, pain specialists, spine surgeons, all working together so that you're seen by the right person, but sometimes working together to achieve that goal. Please visit our website or call us or email us. We'd be very happy to help you.